Have you noticed a bit of thinning happening on top of your head? I'm going to show you a revolutionary process that can give you a full head of hair, whether you're male or female, and reboot your confidence. Today on The Younger You.
I'm on top of the world and now I'm living, and the good just gets better, keeps on giving. Not even close to the end, it's just beginning. Life is getting lighter while the days are getting brighter, yeah. And it's a good, I won't even worry anymore. Took all my cares, still can kick them all out the door. Go on and try, come and tell me what you're waiting for. Move and keep them going till your life is overflowing, yeah.
Hair loss can be caused by a multitude of factors, including aging, changes in hormones, or a family history of hair loss. Well, this affects both men and women. So today we're talking about a new treatment called PRP therapy. Well, here with us today on the show is double board certified plastic surgeon Dr. Reuben from Trilogy Medical Centre, and he's the man that's been doing this whole restoration for us. How are you, my friend?
Good, how are you?
Nice to see you again. Explain to everyone at home what they think is a traditional hair transplant.
The older technique of hair transplant is where we make an incision across the back of the head, so what we call the occiput. That's typically where the hair is preserved. So most male pattern baldness, for example, it's the top, it's the sides, but not the back. And so we take a strip of scalp, literally make an incision, remove the scalp, sew it back together, so there's a scar that goes across the back of the head. Then we take out the individual follicles
One by one,
and do the transplant. And so simply putting them back in, that's the hair plugs that people are probably familiar with.
What is wrong with having that procedure still?
It's not. It's still a great procedure. There's many centers that do it quite frequently. So if someone has no hair, okay, they have complete baldness, hair plugs are really the only thing that's going to work.
Got you.
So if they have absolutely
that's
bald
last
scalp.
resort. That's why you are specialising in this PRP transplant. It's PRP transplant, PRP therapy.
PRP therapy.
You prefer to call it the therapy side of things. Is it surgical?
No, it's a non-surgical technique. And so what it is basically, we're using the power of the body's own healing mechanism. So platelet-rich protein, that's what PRP, it's an acronym. Platelets are the cells in our body that are responsible for the healing mechanism, okay? So when you cut yourself and you bleed for a second and then you stop, well, that's the platelets that are doing that. Platelets release tons of factors, okay, in order to do that. They don't just plug the hole. Well, they plug the hole, but they also release all these factors, all these growth hormones, growth factors that then help mend the skin. So we're utilizing the power of the body's own healing mechanism to help restore the hair follicles which are starting to fade.
This is why I'm thinking to myself, it's better for people who are thinning,
correct,
not who are completely bald.
Right.
It's not necessarily going to work in that process.
Absolutely.
But I'm just thinking in my mind as I'm talking to you, as everyone will be at home, PRP came out quite a few years ago for facials, and I think Kim Kardashian was talking about the vampire facial.
It's similar, not exactly the same, but the vampire facial.
Give me the difference, yeah.
So what we're doing with PRP is, so how do we get the PRP? Well, we draw your blood, okay, similar to the vampire facial. But we then spin it down in these special tubes and separate the blood cells, because all we want is the platelets, right? The blood cells don't have those same hormones that they release, so it's really the platelets that we're interested in. So we spin it down in a special tube which separates the blood cells.
It's like when you do liposuction and you're spinning it on the machine to separate the fat.
We siphon off that top layer, that's what we call the buffy layer, where those platelets are sitting. So we get a very high concentration of those platelets. We then inject them into the scalp with a needle, and then we use a special microneedling pen to do another layer of injections to deliver the platelets and these factors.
I'm thinking to myself, this isn't an instant gratification visually.
Correct.
Because it's not like an eye lift or an injectable. Is it several times that you need this procedure?
So we usually would do one treatment followed by a second treatment at 3 to 4 months. Sometimes we'll do it at 6 months or even 8 months, but typically 3 to 4 months for a second treatment, and even a third treatment, another 3 to 4 months down this.
Could you keep going?
You could. Well, what we're going to see is we're going to see diminishing results. So if we've got a great result and the patient says, God, this is amazing, I don't think I need any more, then we're good. If we see pretty good results, we'll say, yeah, let's do another round, see if we can get you to that great result phase. Then we'll do a second round.
When you say diminished results, I don't want people to think that the hair's falling out.
No.
You just get this incredible spurt of growth, and then it just sort of teeters.
Yeah, it's not going to continue. You're not going to keep growing hair until you're the the Sasquatch.
I'm thinking to myself, I'll end up with this full head of
Mane,
hair.
yeah.
This mane, and I can
No.
have typical boy band hair back
Yeah.
like I used to. Yeah, I gotcha. Different results between men and women.
So hair loss in men, so there's many different types of hair loss. So this is really specific for androgen-related hair loss. So male pattern baldness is where it really works
Interesting.
well. So there are tons of, so alopecia is the name for hair loss, okay?
Yes.
There's a lot of reasons why people can have alopecia. There's a lot of autoimmune ones where your body's immune system actually attacks the hair follicles. This is not going to help a whole lot.
Someone wrote in asking to ask you if they've had alopecia, will this work?
So alopecia, again, is just a broad term for hair loss. Depends on why they have alopecia.
Oh.
So if it's an autoimmune disorder, their body's own immune system is attacking it.
Okay.
If it's medication related, for example, there can be a lot of different reasons. Patients that have gone through chemotherapy can have thin or very thin or even lose their hair. This is not going to be one of those mechanisms that helps. What really works well is male pattern baldness, this androgen-related.
Okay, I understand.
It's a sex hormone-related hair loss.
Thank you so much, Dr. Reuben. Well, don't go away. We're going to continue our conversation regarding this fantastic procedure. And then you're going to get to meet today's patients, David and John. Welcome back to The Younger You. Well, we're continuing our conversation about hair restoration and more specifically a treatment called platelet-rich plasma therapy, where your own plasma is used to restore your hair follicles. Dr. Reuben, studies show that people getting what we know as the traditional hair transplant surgery is down by 65%. Do you feel that PRP treatment is the way to go, and that's why it's a much easier process for people?
It's a ton easier than a traditional hair transplant. A traditional hair transplant, it's a 6-8 hour operation or procedure. With this therapy, it's very, very simple. We can be done in less than an hour, and it's really designed, it's ideal for people that are just starting to thin. So, you know, if someone comes in for a hair transplant and they're just starting to thin, oftentimes they'll say, you know, you're not quite a candidate yet. You know, you need more hair loss, for example.
But we can just top you up a little bit.
Yeah.
And
but
it's a preventative.
This is preventative.
I love
PRP is preventative.
Because this is new technology, are we still finding out the facts?
We are. So there's some studies that are now about 3 to 5 years out on PRP for hair therapy, and we're seeing great results. They're smaller studies, so now we're trying to accumulate bigger and bigger studies with more and more patients. But yeah, it's exciting technology. Thinking about it, you can avoid potentially, you know, long-term.
Can this type of therapy be used for people who have an autoimmune disorder like alopecia? You've touched on it.
We touched on it.
Let's break that down a little bit more, please.
Generally, it's not going to be as effective. The studies that are out right now are looking at purely androgen-related hair loss, so male pattern baldness.
Well, and I'm going to be honest here at home with everyone that I have a little bald spot that I went through something when I was younger and I lost some hair. Are you saying that I couldn't have that part just rolled and it might come back?
It's reasonable to try, absolutely. But for people that have significant, you know, autoimmune alopecia where they're missing a lot of hair, 80% of their hair volume is gone, we're probably not going to get as good of a result.
Well, let's go meet our patients, David and John, and talk to them both about why they are going with the PRP treatment from Trilogy Medical Centre before we watch the procedure happen.
My name is John Perry. I'm 30 years old and I'm getting the PRP procedure from Trilogy Medical Center. Hair restoration for me, it's always been something that I've looked at, and it seems like the risk has never outweighed the benefits, and it's something I've always been insecure about, and I would love to see if this works, and it sounds like it will.
My name is David, and I am getting a procedure to thicken my hair. I've had concerns about it falling out and thinning down, and I'm almost 60, and so I'd like to have it, you know, thicker and keep what I've got.
I found Trilogy online. I was searching for, I guess, hair loss or hair thinning or something like that, and they were the first one. Trilogy popped up and they had this new procedure, and I watched a little video on it and I was hooked.
I thought of this because I had seen it on a national television show, and I was aware of that, and right after that my friend was calling me and saying, you know, why don't we try this procedure on you? So I'm here.
My dad had thinning hair, so I think it definitely runs in my family, and then my mother's father also had thinning hair as well, so it seems like it was kind of on both sides, so it definitely could be a genetic factor for me. I think I first noticed when I was like 26 years old that I was losing my hair. You know, I started to come back from the mountain and I would take off my helmet or hat from underneath my helmet. my hair would be wet and I would notice that it was visibly thinner. It was never like dramatic loss, but it was always getting thinner and thinner in the crown of my head, and then in the front of my head I started to notice it a lot.
I am thinning in the cranial top and towards the back, male pattern balding, and I was noticing it on some friends of mine, and they said, if you think we're the only ones, look in the mirror. I like to look good, I like to feel young, and I like to keep myself in pretty good shape. So keeping hair, I think it's that way with a woman and a man. It just makes you feel better and younger.
What my wife thinks, she was like, just kind of let it go, let it be natural, one day if you gotta shave your head, shave it, otherwise just style around it. So she's always been like super supportive, but when I told her about this, she was definitely really interested. She was kind of excited that the same thing, it was really natural and it was from your own blood, so she's excited to see if it actually works.
The other thing that I considered, because I have a couple of doctor friends and relatives, and we had discussed alternative things, Rogaine and other things like there's pills out there that you can take, and the side effects to some of that stuff didn't appeal to me because I'm kind of a health conscientious person. So I felt like this was using your own bodily fluids, if you can put it that way, that it made more sense.
I guess turning 30 is definitely a milestone in my life, and getting a little bit older definitely factors into it. Looking into the mirror and then seeing the hair loss, and you don't really feel old, but you're starting to look old. You get a little bit of crow's feet, your hair is starting to thin out a little bit. So it'll be nice to get some of that power back and feel as young, look as young as I feel.
The reason that I really am motivated with this is because my 60th is coming up very soon, and I would like to look younger, and I would like to feel better about myself, and this is going to help achieve that. It's like the icing on the cake, on the top of the cake.
After the short break, we are going to watch the process of the PRP therapy as Dr. Reuben performs the procedure on David and John. Closed captioning for The Younger You is brought to you by Mindful Medical. Like us on Facebook for updates on the show and how to join the Younger You conversation. Now it's time to watch as our patients undergo their hair restoration procedures at Trilogy Medical Centre.
So PRP is an acronym for what's called platelet-rich plasma. And so what we're doing is we're taking whole blood from the patient. We're then separating the red blood cells from the plasma. The plasma is now rich with platelets. Platelets are a very important cell in wound healing as well as for blood clotting. And what we're seeing is that when we use it for hair restoration, for example, it's a very reasonable way to help increase the follicle regeneration and convert inactive hair follicles to active hair follicles. Using our own plasma, we're doing cellular therapy. We're using the body's own healing system to improve the yield or improve the stimulation of the hair follicles. So there are no other creams or ointments that can mimic this. This is truly cellular therapy, harnessing the power of these platelets with their growth factors. The benefit of it is your own cells. There's no rejection. It keeps the cost down, right? Because we're using your own blood cells that we're harvesting, and so we're not using some other medication or something else that's been created by a manufacturer.
This is the newest technology for hair restoration. So it's non-invasive, it's not surgical. People can have it done, be in and out in a day, and there's really no downtime for them. Very little pain. It's probably the most promising technology out there for hair restoration without surgery.
Take a white marker, and we're just going to kind of draw where I see hair follicles.
People who are the best candidates are ones that have the androgen-sensitive male pattern baldness, what we call androgenetic male pattern baldness. So that gene sort of becomes active at the time of puberty for men when their hormone levels start to increase, testosterone levels. So men can start to have male pattern baldness at a very young age, even in their teens or early 20s, if they have a very strong genetic component. The sooner that you come in for treatments, the better we're going to have, the better chance that we have at stimulating the follicles. What we're trying to do is convert inactive hair follicles to active hair follicles. If hair follicles are inactive for too long, they become totally quiescent, and we have this V-less type of hair. What we're trying to create is terminal hair. It's the true hair that we have on the top of the head, the darker, larger hair. So the more that, the earlier that we treat, we have a better chance at stimulating those follicles to create growth. But if all those follicles are gone and they've been gone for a long time, there's a very low chance that we're going to get any significant regeneration.
So people that are doing this, it can be for men, it can be for women. For men, if we can catch it before they've lost their hair, this won't work on hair on scalps that are already balding, that don't have a follicle. So I can't stimulate a hair to grow in that, but anywhere they've got slight hair growth, then I can actually inject that serum into that and make it grow. So Dr. Reuben injects it into the scalp. We get a good depth into the hairline.
So what we're going to be doing is
I'm still alive.
taking the PRP solution that we've spun down now, and we're going to be injecting it into the scalp along where we want to try and create some more hair regeneration or increase the follicle units of the scalp. We do multiple injections across the scalp, so we're trying to inject just below the skin into the fat layer of the scalp, and we're dropping little aliquots of this PRP. So we're delivering little aliquots of platelets that can release these growth factors right where the hair follicles are. And so we do it in a small syringe just so it's a little bit more controlled. What we're trying to do with this is harness these platelets so they secrete these very special growth factors around the areas of our follicles, our hair follicles that we're trying to regenerate.
And then we go in and do a micro pen that we can penetrate the product in just more superficially.
Same stuff that's injected with the needle. Now I'm just going to the surface here.
There's no downtime with this. They do get a little red. You can see that they had it's a little uncomfortable for them. But outside of that, they do have little pinholes in their head for a few days. But really, they can't wash their hair for about 24 hours. And then in about 48 hours, they start using a little stem cell procedure, a little product that we get for them, and they put it on their head to actually help, make that grow a little bit better.
Just do 10 little drops in the morning and 10 little drops in the evening before you go to bed, and you'll do that for a month.
Usually in about 30 days they'll actually see change, and they'll see little hair growth. They'll start to see little baby hair starting to come out. In 3 to 6 months you really can see a lot of growth at this stage. You can do it again if you want to just give it a little bit more in about 30 days to 60 days. Usually once they get this going, people always ask me, am I going to have to continue to do this? Not necessarily, but it's just like everything else. We're aging, our hormones are changing, and if you want to continue to keep a full set of hair, yeah, then probably it's going to be a maintenance thing for you to kind of come in and have it done. So that's what I would recommend to any of my clients, that in order to keep the hair thick that they'd like, then I would recommend that they do it at least twice a year.
Stick with us, David and John will be here so we can see their final results. Well, it's man time on the couch, and I've never said that before, but now we get to see the before and after shots. Take a look. Okay guys, let's be serious. There has to be some sort of pain there.
There was pain involved.
How much?
First procedure, I wanted numbing cream, I wanted everything.
Oh,
and the second time, nothing. I said, go ahead and do the procedure without the numbing cream.
Really?
It was just a different sensation, and the doctors there are nice, they talk you through it, they're talking to you the whole time. So
Tell
you
me
just
what the
relax.
sensation feels like though.
It's a pinch every now and then. So every once in a while you kind of feel it, sometimes you don't. It kind of makes your eyes water a little bit, but I
We
think I
know
was,
you're weak.
Yeah,
And
I was
jump.
kind of the big baby. They kept telling me that he's not using the numbing cream, he doesn't want anything. They keep giving him shots, and I was like, what? So I was like tearing in my right eye, I remember, and Rhonda's like, oh, it's okay, everybody cries during this.
Tell me, Tom Brady had the traditional transplant?
He did. Tom Brady had it, and he had decent results, but I would say, you know, obviously my results were much better.
So do you need to give him a buzz and give him Dr. Reuben's details?
Yeah, I mean, probably.
Bring him in. We may need to bring
Do we
him
want
in.
to put his number up on the screen for him?
Okay, what is done at home? Did they have home care services that they had to take care of?
So there's a medication that we have them take, which is a blocker of one of the hormones that helps break down the hair follicles.
What is that?
It's the tradition that's known as Rogaine or minoxidil. We have a special formulation of it, and it's topical. You put it on the area that we treat, and what it does is it helps lock the enzyme that leads to male pattern baldness. And so we're adding in the growth factors to help grow the follicles. The topical ointment is trying to prevent the body's hormones from breaking down the hair follicles.
Okay, is this something you have to maintain forever using those shampoos?
Yeah, generally, yes.
Are you?
Yeah, I've been doing it every morning
day?
and every night.
Does it feel the same?
Go ahead and...
Well, I didn't feel it before.
well,
You're letting out secrets
You
here,
could
John.
probably see what it feels like. I think my wife notices
Does
the
it
biggest
feel
difference.
wiry?
No.
Okay, so
it's
it
just
truly...
same hair.
Okay.
It just feels thicker. Everywhere where it
Yes,
was thin, it's
volume.
kind of filled in, but where your hair was already thick, now it's like really, really thick.
You just didn't do that one spot.
Oh no, we treat the whole area.
Yeah.
Especially for thinning, because John was thinning in one very noticeable area, but also
we just saw it.
also generally across the top of his scalp as well.
Yeah.
I mean, too bad we don't have some great. If we had some great, when I'm injecting the scalp, you can really see how actual thin it was.
Interesting. What about you?
So all the top, male pattern baldness back here.
Okay.
I wanted more, hairline to come down. But again, where there's not hair, it doesn't grow. It's
I'm
only where
glad
the
you've just
hair
said
is.
that, because I personally feel that this was something for me when I first started researching this process. And my hairline was much further forward. But I am bald there. That is the way it is. There's
doesn't grow
nothing I
back.
can do about it with this treatment.
Correct. Hair transplant would be your only way of bringing it forward.
Guys, I think you both look amazing. And if it was me, I'd be
I feel
going in for a
better.
third treatment and fourth. I want a mane of hair. I want Fabio.
Yeah,
Hair.
I mean, I think everybody should go and get it done if you're thinning.
Definitely, when you start noticing it, go in. Don't wait too long like my brothers did.
Well, I was going to say, have any of your buddies seen a difference? Like, if you haven't seen a mate in 3 or 4 months,
My girl that does my hair notices it.
Really?
And I didn't tell her. And she wondered what I was doing, and she thought it was some product I was just using to
Yeah.
thicken my hair.
Yeah.
I told her about the procedure, and so she,
Okay.
she will recommend it now to Trilogy.
interesting.
So-
What about you, Bud?
Yeah, my barber noticed the same thing. He went on vacation, so I hadn't seen him for about 2 months. I had to go to somebody else in between.
Yeah.
And he was like, "What did you do to your hair, man?" He's like, "Did you get a new cut?" And I was like, "No." I was like, "You notice anything?" And he's like, "I don't
do
know." He's
notice.
like, "It looks fuller."
Yeah, you say, watch the younger you in a few weeks, my friend. Thank you so much. We really appreciate it. Dr. Reuben, great result.
Yeah. Yes.
I wasn't sure what we were going to get, so I'm pleasantly surprised. Well, if you're sitting at home and you're one that has thinning hair or receding hairline and you can't ignore it anymore, then maybe it's time to head over to Trilogy Medical Centre and have a little bit of PRP, as it could be the perfect solution for you. For more information about the show or Trilogy Medical Centre, please visit our website at theyoungeryou.tv. And next week, I could have a full head of hair. See you soon. Find out next week how Dr. Red and the team at Red River Health and Wellness can help someone suffering from Hashimoto's disease. Okay, first thing, what is low thyroid?
Okay, this is when your thyroid is not producing the proper life-sustaining thyroid hormones that your body needs.
The Younger You set provided by Madison McCord Interiors.